Good morning, everyone. My name is Patrick Edsenga, and I am here with my colleague and friend, Matt O'Rourke, and we're going to be presenting to you today on what to do when an employee tests positive for COVID-19, which is something that some of you may have dealt with already, and others of you are sure to deal with. So let's just get a little update on sort of where things stand with COVID-19 statewide across Michigan and nationally as of this morning. So the latest statistics out of Michigan, which are actually from yesterday, is that just over 17,000 people have tested positive for COVID-19. Monday was the 8th consecutive day of more than 1,000 new cases in Michigan. There are now 727 deaths in Michigan, 110 in the last 24 hours. These numbers rank Michigan third in the nation in number of positive cases and in number of deaths. Across the United States, there are nearly 370,000 positive COVID cases at this point. And we are getting dire warnings over the next 2 weeks about what may happen as we sort of reach the top of the curve here. Don't say this to scare anyone, but just to set the background for our discussion today. Like I said, several of you may have already dealt with this. I have talked with several clients about employees testing positive and the steps they need to take, and that's sort of the genesis for this whole webinar. And if you haven't dealt with it yet, just the way these numbers are rising and how contagious this particular virus is, you're very likely to deal with it soon. It's currently concentrated far more on the east side of our state, but it is making its way over here, and it's anticipated that we will peak after the east side of the state peaks, so we're going to be dealing with it for some time to come. So with that background, we thought it would be good to talk about what's the protocol when somebody tests positive? What are the steps that somebody needs to do? And a couple caveats here as we get going. If you're a healthcare provider, some of what we're saying may not apply to you. You may need to take a different course of action based on your staffing needs and CDC guidance, which is separate for healthcare providers. Also, we are lawyers. We've studied this a lot, but we are not doctors. And so if you're working with a public health official, you should always be following their guidance, and we'll remind you of that again. But those are a couple of important caveats. And the third one is positive tests, your workplace, number of employees who might be impacted are all very fact specific. So we would encourage all of you, if you're dealing with this situation, to get on the phone with your lawyer and anyone else who might be able to provide you with guidance to sort of help you navigate through the situation and how to best handle it. These are going to be sort of some principles based on state and federal guidance and just our own experiences, but these are very fact-specific situations. So with all of those caveats, let's get it rolling here. So what we're going to cover today is really 4 things. It was going to be 3, but as has been happening a lot lately, the state issued a new executive order recently that greatly impacts what we're going to be talking about today. So we feel like it's important to cover that, and that is Executive Order 2020-36. And just so everybody knows, we're going to be doing, not Matt and I, but other lawyers at Miller Johnson are going to be doing an in-depth webinar tomorrow morning on this exact executive order, its impact on employers, sort of best practices for operating while this executive order is in place. So that is going to be the first thing we talk about, and then we'll talk about what you should do when an employee tests positive. We'll walk you through the steps that the CDC would recommend, that the state would recommend. We're going to talk about how you can clean and sanitize your workplace. And then finally, we're going to talk about when is it safe for employees to return to work, both employees who test positive and employees who might have been exposed to someone who tested positive or who at least have some symptoms of COVID. So We'll walk through each of those for you today. We'll try and answer as many of your questions as we can, and Matt and I will try and make this one a little more interactive. It's a little less heavy on the law, so we might be able to have a little more of a discussion between each other as well. But if you have questions, please send them in, and like I said, we'll do our best to get to as many of them as we can. And with that, I'm going to let Matt take it away on the executive order that came out on Friday.
Well, good morning, everybody. And before we get into the executive order here, I just want to say one thing and give a word of warning. Both Patrick and I are working from home with previous executive orders being in effect, and we both have a dog and young children at home. It is currently breakfast time in the O'Rourke household for my 1-year-old son, and that usually involves lots of screaming and excitement. So if you hear that in the background, I just want to apologize in advance and let you know that everything is okay here. It is just breakfast time. But on to what you're here for, Executive Order 2020-36. This was Governor Whitmer's 32nd executive order as it pertains to COVID-19 and everything that's going on with it. We're now up to 34 total as it relates to the virus. She signed it and issued it last Friday, and you've probably heard bits and pieces about it already, but this is really another step to limit the spread of COVID-19 among people who are working. So we saw the executive order a few weeks ago, which really limited those individuals who can work to essential infrastructure businesses and a couple other exceptions there. And now what the governor is doing is looking at those individuals who still are allowed to work under her previous executive orders, and she's figuring out how can the state work with the individuals who are working to try to limit the spread of the virus even further. So what this executive order does is that it requires employees who are allowed to go to work to stay at home if they or individuals with whom they have interacted are at risk of spreading COVID-19. And then it also prohibits employers from disciplining or discharging or otherwise retaliating against employees if they decide to not go to work because of either symptoms they have or individuals with whom they have interacted. And if we look at, and we'll get into this in a second, if we look at the individuals who are identified in this latest executive order and compare it to especially Executive Order 2020-10, which I'm sure if you're like me, you don't have the numbers committed to your memory here, but 2020-10 was the executive order that dealt with unemployment insurance and really expanded unemployment benefits to Michigan workers. And we see a lot of overlap between both those individuals who are qualified for extended unemployment benefits and those individuals who are now encouraged to stay home because of their interactions or potential interactions with the virus. So what does this executive order require? Well, two things, and as we've already alluded to already, it requires certain employees to stay at home, and then it protects them when they do. So first, employees staying at home. Those employees who test positive for COVID-19 or who display any principal symptom of COVID-19 should stay home. And we'll get into what exactly is a principal symptom according to the state in just a second. Also, employees who have close contact with anybody who either tested positive or who has a principal symptom of COVID-19 should stay home. So this is pretty broad. When we get into the principal symptoms, you'll see that we're talking about everything that we know. We're talking about coughs, and we're talking about fevers. So the executive order and the governor is saying that if one of our employees has just interacted with another person who has maybe a cough or a fever, that person should stay home. And then the second part of the executive order is that employees are protected. So they can't be discharged or disciplined or retaliated against if they stay home for either of those reasons while the executive order is in effect. So let's dig into this a little more. What exactly is close contact? Well, the executive order defines it as being within 6 feet of an infected individual or an individual with a principal symptom for a prolonged period of time. So good, we are defining things here with more terms that need even more definition. This is consistent, though, with CDC guidance. The CDC tells us that having contact with either a person or with somebody who has secreted, usually sneezed or coughed, that we should quarantine or isolate those individuals who have interacted with people who have symptoms. The CDC doesn't define prolonged period because they say that their data is inconclusive as to what it means. Some reports and some research show that 10 minutes could be prolonged. Other reports and research show that 30 minutes could be prolonged. Again, if we're in the healthcare setting here, the CDC says that close encounters with somebody who has been diagnosed with COVID-19 could be something as small as just a few minutes. So we don't have an exact definition for what prolonged period means. And this is one of the situations where when we're trying to decide whether or not somebody qualifies under the executive order, we're going to need to sit down and look at exactly what's going on. What was their contact with the individual? Did the individual have a diagnosed case? Did they just have symptoms? What was the interaction with the symptoms? There are a lot of details and information that we will have to try to figure out in order to determine whether somebody interacted with an individual for a prolonged period of time. And then again, principal symptoms, as we have already said, we're talking about fever, atypical cough, atypical shortness of breath, all of the things that we all know now are associated with COVID-19. If any of those are present, then this is where the executive order is going to come into play.
And Matt, I'll just jump in real quick here on fever. What the CDC says is it's either 100.4 degrees is a fever, or there's more of a subjective component where somebody is just feeling, quote, feverish. What they say is some people might not have a fever if they're immunosuppressed or they're older. Other people will have a fever, and some people may not have one but may feel feverish. They may have an elevated temperature for what they normally run at, but it wouldn't necessarily qualify as a fever. So even there's a bit of a subjective component.
That's a good point. So going back and looking at what these principal symptoms are according to the state, it's atypical cough, atypical shortness of breath. So this is almost entirely subjective for each individual. And we can get into this in a little bit when we talk about how do we document some of these things and what information do we need from employees. But I think it's going to be tough in many of these situations to actually dig in and do an investigation, because what is an atypical cough for one person is not going to be for another person. And we almost have to rely on the person who is coughing or the person who has shortness of breath to tell us whether that is a typical cough and typical shortness of breath or whether it's atypical. So there's a lot of moving parts with this, and just the use of the word atypical and the fact that, like you're saying, Patrick, fever could depend on one person and be different for another person shows just how broad the executive order is intended to be. So how long must employees stay home if they do identify either with any of these symptoms or interact with anybody who has these symptoms? First, if an individual, so our employee, tests positive or has a symptom for COVID-19, we know then, based on the executive order, that the employee has to stay home until at least 3 days have passed since their symptoms have resolved. And both the executive order and the CDC tells us that that means usually no cough, no shortness of breath, and that a fever has been reduced for at least 3 days without using fever-reducing medication. And then at least 7 days have passed since the employee's symptoms first appeared, or since they took or had a COVID-19 test administered and tested positive for it. So a combination of at least 7 days since first symptoms, try saying that 10 times fast, and then 3 days since all the symptoms have resolved. If somebody says that they have been exposed to an individual with COVID-19 or a person with symptoms of COVID-19, then it is 14 days have to pass since the last close contact with the sick or the symptomatic individual, or if our employee is able to get a test for COVID-19 and test negative, then he or she may return to work immediately upon receiving that negative test. But again, the executive order, which closely matches the CDC, is telling us, or I think assuming, that most people are not going to have access to a test. And so it's the 14-day window that we're all familiar with, understanding that most of the symptoms of COVID-19 will show up within 14 days of exposure. And so the executive order is telling us that if somebody interacts with an individual who has these symptoms or who has been diagnosed, we should let that 14-day window run.
And so I think, Matt, it's probably a good time to pause to consider what each of these means as for how long somebody actually might be out. And so I think for the first one, individuals who test positive or have a symptom, the way to think about it is it's a minimum of 7 days. And that's if the person really is, mild symptoms, they resolve quickly. You're going to be out for 7 days. And as long as on the fourth day and beyond, that person doesn't have any symptoms, they're going to be able to come to work after their 7th day. However, I mean, that could drag on 2 weeks, 3 weeks, depending on if the person's symptoms persist. And we see a lot of reports that people's symptoms can and do persist for a couple weeks at least. And so it really is going to vary depending on the person. And then for the individuals who are exposed to a positive person or a person with a symptom, your guess is as good as ours as to how long they could be out. But a situation that might occur is you live with somebody, they have an atypical cough, you're around them. It's hard to get away from them, even if you try and quarantine them. So maybe once their cough resolves, now you have 14 days from that point. But as you near the end of that 14 days, maybe somebody else in your household gets a cough that's atypical. And now you're waiting again, more and more time is passing. I mean, you could look at a month and a half here, depending on how all this works out. So just wanted to lay it out there that that's at least a possibility, the way the state has defined these things and when it's safe for people to come back to work. And it is consistent with the CDC guidance.
Right. And one question we received this morning is an employee or an individual immune after they have finished their home isolation period and after they've been at home for 14 days or after their symptoms have passed? Are they then immune from reinfection? I'm not a doctor and I didn't stay in a Holiday Inn Express last night, but my understanding is that people are susceptible to getting the virus again, that simply being exposed to it once does not make a person immune or prevent them from getting it another time. So like you're saying, this could be something where somebody stays at home for a period of time because either they showed symptoms or interacted with somebody, and they might in a couple of weeks or a month later get the symptoms again or interact with somebody again who has the virus or has symptoms of the virus and might need to stay home an additional time for an additional period based on whatever situation presents there. Is that your understanding as well, Patrick?
Yeah, I think it is. And I think this would be if you're working with a public health official after one of your employees tests positive, that's the perfect type of thing to ask that public health official. Look, when this person comes back, if they're exposed to somebody else who has symptoms or who did test positive, are they at the same risk? Do they need to be quarantined again? That's a great question to ask the public health official if you're able to do so. This was also a good time to let you all know that we're attempting, at least, our hope is that we're going to be able to get an infectious disease doctor on a webinar in the near future. We're working on doing that now. Would encourage you all to attend that one. That's the type of person that is going to be, far better qualified than Matt or I to answer that question. But Matt's understanding is my understanding as well.
Okay, so now that we have gone over that, let's talk about the actual type of leave that under the executive order employees are entitled to. So first question is, or the first point is that any leave that an employee takes under the executive order can be credited from his or her accrued paid leave, but it's not required. So this is something that employers can work with employees on, or employers can simply mandate that employees take their accrued paid leave. There's a lot of discretion here left to employers. If no paid leave is available, though, we're talking PTO, sick time, time under the Michigan Paid Medical Leave Act, really any type of paid leave that would come into play here. And if none of that is available, then this leave can be unpaid. In terms of interaction with the FSCRA, the federal law which gives emergency FMLA, extended FMLA, and then emergency paid sick leave. So let's talk first about individuals who have COVID-19. If they actually are diagnosed with the virus, then obviously we're going to be handling this as we would with most other serious medical conditions or serious health conditions, and so the FMLA is going to come into play there. But then also, assuming that they have been advised by a healthcare provider to self-quarantine for COVID-19, they would likely qualify for the emergency paid sick leave. And I can't imagine there would be a situation where somebody actually has the virus and they were not told by a healthcare provider to self-quarantine. If somebody has symptoms and is seeking a medical diagnosis, then as we're all familiar with, then yes, they also would qualify for the emergency paid sick leave. If somebody, though, when we get into the employees who have interacted with somebody either who has COVID-19 or who has symptoms, and they don't have a medical diagnosis themselves, then I think it's less clear, and a lot of it's going to depend on the circumstances, but those individuals, many of them will likely not qualify for the emergency paid sick leave. The bigger question, though, is whether this executive order qualifies for that first bullet point, that first qualifying event in the Act, which is for employees who are required to stay home and miss work because of a federal, state, or local quarantine or isolation order related to COVID-19. There's a lot of debate and uncertainty, and certainly the Department of Labor, when it issued its regulations, did not make the situation any more clear last week. I think a lot of it is going to depend, again, on the individual circumstances, and trust me, it brings me no joy to give you an undefined kind of answer like that, but we really are going to need to dig into what is the employee telling us, who did the employee interact with, what were the symptoms, is the employee showing symptoms. There's a lot going on here, but we think there's at least an argument in most situations that somebody who stays home because of this executive order is staying home because of a state quarantine or isolation order related to COVID-19. And so that employee might qualify for some of the paid sick leave under the federal law. But that's something that before you make any of those decisions, we would recommend that you reach out to your employment counsel to go over a number of those factors that we've discussed and to try to figure out exactly what the best situation is both for the employer and the employee. On the positive side, if the employee does qualify for the emergency paid sick leave, then of course the employer would be entitled to the tax credits on the back end. So it's not necessarily all a bad situation if the employee qualifies for that paid leave. But again, there's a number of things that we'd want to dig into before making that decision. In terms of documentation, this is the other big issue, and this is especially, again, as we're talking about the interaction of the executive order with the FFCRA, documentation is important here because for FFCRA purposes, if somebody is entitled to the paid leave, the IRS is telling us that we want to have some documentation of the employee's need for the leave so that we can prove eligibility for tax credits on the back end. I don't want to say problem, but the hurdle that we're seeing with the executive order is that employees cannot be disciplined or discharged for failing to provide documentation that either they have a symptom of COVID-19 or they have been exposed to somebody with a symptom of COVID-19. So it's interesting the way that the executive order is phrased because it doesn't prohibit us from asking for documentation, and it doesn't prohibit us from requiring documentation. It just prohibits us from disciplining somebody for not following through with that requirement. So what that really means is, for all intents and purposes, we can ask for documentation of the employee's need for leave, but at the end of the day, we can't hold their feet to the fire and make them provide it. So if we're in the situation where we want to document the need for leave because we think we're going to request tax credits after all this is said and done, there are a couple options that we see that are possible and that we think kind of cover all of our legal obligations here. The first would be to get the information orally from the employee. Tell us what's going on, tell us what your symptoms are, who did you interact with, what was that person's symptoms, when did you interact with that person. Try to get as much information as you can, and then, of course, as you would do in any situation with any employee-related event, you would document that as much as possible. Second would be to have employees complete leave request forms. We have put together some leave request forms both for the emergency paid sick leave and for the extended FMLA leave, and we would be happy to work with you on those. And you can use those forms to have the employees request leave, and then at least you have a documented request for whatever the situation is. Third would be to require supporting documentation with those request forms. And obviously that is the best situation if we are looking at documenting everything that we're doing, because then we have both the request from the employee and some sort of likely medical documentation showing that the employee has the need for the leave. But it's also going to be the most difficult to enforce because of the executive order's provision that we cannot actually discipline or discharge employees if they fail to provide the requested documentation. So somewhere on that spectrum is an option that will work for you and your organization and your employees. But again, each one is going to vary based on the individual circumstances, and so not to dig into it too much, but we really would recommend reaching out to your counsel to talk through some of those options and what works best for you before getting into this too much with the employees and getting too far down the road.
And I think, Matt, one of the oddities that can occur here is somebody might be protected by the executive order, which says we can't require any sort of documentation. But if they don't provide us with sufficient information for us to give them the paid sick leave and really to allow us to get the tax credit, which isn't that much information in fairness, but if they don't provide that, then we could deny them paid sick leave while also still having to allow them to be off to use their Michigan paid sick leave and possibly to use their other accrued leave They just might be denied the federal paid sick leave. So that's one of the oddities that can occur. But before you're going to do something like that, like Matt said, that's a situation you want to talk to your lawyer about. And we do have a couple questions here that we can answer really quick. First one is, if an individual shows symptoms and then has a test and it's a negative, do they have to wait 7 days because of the symptoms, or can they come back immediately? My understanding, and Matt, let me know if you disagree, is that they can come back immediately. The executive order does contemplate that when somebody gets a negative test, they're able to come back to work.
Yep, that's my understanding.
You wouldn't need to wait the whole. Yep. So that's one. Another is, how do we verify the date the symptoms go away within the period of the executive order? Is it an honor system? Is it a doctor's statement? Really, I think it's an honors system to a degree. You certainly can ask for a doctor's statement. I don't know about requiring one. I think it is a good idea to tell the employee you'd like to get confirmation from their physician that they're able to return to work. But one of the things the executive order says is that if somebody returns before the prescribed periods that we were talking about earlier, they can be disciplined or discharged for that. So when communicating with the employee, you can let them know, you know, this is serious, you're theoretically contagious here. We need to know for sure that your symptoms have resolved themselves, and if not, you know, you could face disciplinary action up to and including discharge. So I think that might be the best way to handle that if the employee is saying that they haven't consulted a doctor or whatever just because they have a cough. But generally speaking, it never hurts to ask the employee to provide a doctor's note without requiring it. Another one, are we able to speak with the employee's physician directly for clarifying questions? Yes, if the employee will authorize it. And so, you know, this might not be the time to be getting, you know, medical releases, but if you can get a medical release, that's one way to do it. Another way to do it is to have the employee on the phone with the physician and you, if they're agreeable to that. But I wouldn't be reaching out to the employee's physician directly with clarifying questions unless the employee authorizes it. And in reality, the physician is going to refuse to talk to you without that authorization. All right, Matt, you can go ahead.
All right. And now on to you, Patrick.
All right. So now let's talk about what do we do when an employee tests positive. And I think there's a couple of important considerations here. So what to do when an employee tests positive is not just important because we want to do the right thing to make sure everyone's safe. That's obviously priority number one. But another priority is letting employees know that you're looking out for their best interest, that you're doing everything to make sure that they're safe during this scary and unsettling time. And we're currently in a weird situation where usually just the promise of at-will employment is enough of a carrot to get people to come to work. But in this weird time that we're in, that's not necessarily the case anymore, and it's not the case for a number of reasons. One reason would be that there are people that are just scared to come to work with all of this going on. They're scared of contracting the virus. They're scared to, you know, maybe they have a pre-existing condition or they're in a high-risk category, or maybe somebody they know is in a high-risk category or has a pre-existing condition, but for whatever reason, they might be scared to come to work. Another reason is now, as you all are undoubtedly aware, there's enhanced unemployment benefits available to employees. And so as a result of that, you know, people often can be making more money than they would if they're not at work. They can collect, you know, up to $1,000 a week through unemployment. And so the idea of going to work is just not as enticing for certain people in that situation. And now third, we have an executive order which essentially tells employees you don't have to go to work if you have a cough, if you have shortness of breath, if you are feeling feverish. And of course that makes sense as we're trying to limit the spread of this virus. but it's also the type of thing that can be abused by somebody who might not want to come to work. And so in the normal world, the carrot of at-will employment is sufficient, but this isn't the normal world. And so we need to be looking at other ways to make people come to work, other carrots, if you will. And really one of those carrots here is letting everybody know that their safety is paramount, that you're doing everything you possibly can to keep them safe. And so how you handle a positive test when somebody at work tests positive, people are going to be paying attention. People are going to be more willing to come back to work, generally speaking, if they're confident in the way you handled it, if you've taken every precaution. And if they don't think that you've done so, then they're going to be less confident in coming to work, and now they're going to find maybe one of those excuses that we just talked about. And so I think that's why, on top of just doing the right thing from a safety perspective, it's very important that you handle this the right way. And we'll go through each of these steps, but certainly communicating with all the other employees about what's going on within the confines of the law is a very important aspect of this. So when an employee tests positive, the very first thing you should do is work with that employee and, to the extent possible, the state and local health officials to identify all the other people in your workplace who the employee was in close contact with. And that close contact definition, as a reminder, is if you're within 6 feet of that person for a prolonged period of time, which would be, at a minimum 10 minutes. And the other would be, having direct contact with somebody's infectious secretions, being coughed on, being sneezed on, things of that nature. You should work with the state and local health officials, I say, to the extent possible, because as you might imagine, they're pretty inundated. A couple of clients that I've worked with on this, and I know this is one of the questions we got, what will we hear from the Kent County public health official? Theoretically, you should, but they are certainly busy at the moment. And so one of the clients I work with had to reach out to them several times to try and get in touch with somebody. They eventually were successful in doing so. They just had to be a little persistent. So they may not reach out to you in a timely fashion if they're overwhelmed with, other matters that they're handling. But I think you ought to be reaching out to them to let them know that this is going on, to let them know that you'd like to get guidance on what you should be doing, at least to make sure that you both are on the same page. So reach out to those state and local health officials if they're not reaching out to you. But earlier on, when people were testing positive, they were reaching out to the employer, and they were working closely with the employer to see who else might need to be quarantined. You can provide them with the name of the employee. You can provide them with the names of the other employees. You shouldn't be disclosing the name of the employee who tested positive to anyone else, really. I guess to the employee's doctor, of course you can, but they're going to be aware anyway. But to your employees, you should not be disclosing that individual's name. That's going to be an issue under ADA. And so we don't recommend that. Employees probably will figure it out, especially if you're trying to identify other people who they were in close contact with. But even if they figure it out, don't use their name. And so that's very important. But so you're going to work to figure out who the employees were, and who the positive employee was in close contact with. And, a question might be, I can't get in touch with the public health officials, and maybe the employee's not doing well. They're not in a position to help me figure out who they were in close contact with. What do we do then? Well, I think in that case, what you do is you do the best you can. You figure out where that employee works, who might be in close contact with that employee based on where they work, who maybe they have lunch with, who maybe they go and have a break outside with. You're going to do your best to identify those people, but in many cases, most cases, the employee is going to be able to work with you to help figure that out. And remember, it's not just somebody who happened to cross paths with that employee. They need to be in that employee's presence for a prolonged period of time. So people might want to step up and say, I was in close contact, if they're able to figure out who it is with this person. but really they just walked by them, on the line or in the hall or whatever the case might be. It's got to be that prolonged period of time. Once you identify those people, what do? You send them home. And that was our recommendation before Executive Order 2020-36. It's certainly our recommendation now because that's what the state also wants. But even before that, that's what the CDC was recommending. And that's frankly what employers wanted to do because they want to make sure that their workplace is safe, that the virus isn't spreading around their workplace. And that sort of contact tracing is the best way to do that. So you are going to send those employees home for 14 days, which is what the CDC was recommending. It is also now what the executive order says to do. You're going to explain to them that they can return. You're not, again, going to tell them the name of the employee, even though they're very likely to figure it out. And if the health department recommends something different, you're going to follow that recommendation. But generally speaking, they're not going to recommend anything different than that. This 14-day period is the incubation period for the virus. And so if somebody is exposed to it, I think that the maximum range that somebody can start contracting the virus, giving off the symptoms is 14 days. And that's why the 14 days has been picked. So that's what everybody will tell you to do, and that's what you should do. After you identify the employees that were in close contact, you are going to, and quarantine those employees, you are going to communicate with your other employees. This may seem like a less important stuff, as you might imagine from my earlier comments. I view it as quite important. So employees are going to want to know this. They frankly, have a right to know that there was that the virus has made its way into the workplace. They probably will not be surprised. That is, if they're watching the news at all, they know it's all over the place. But you're going to tell them that someone tested positive. Again, you're not going to name them. After that, you want to reassure them. You want to tell them all the things you're doing to protect them now that somebody has tested positive. If you're able to, you're going to tell them that you're working with the local health department, which hopefully will put them at ease to some degree. You're going to tell them all of the preventative steps that you're taking, right? And this is where, for any number of reasons, those preventative measures that you have in place already, it's very important that they follow them. So this is just the time to hammer it home. It's important that they follow them for a couple reasons. One, it makes them feel safe now, but if they're following them before then, it's really going to limit the number of people who need to go home and be quarantined. If everybody is social distancing at work, if everybody's following the directions that you certainly have given them, now, maybe half your plant floor isn't having to go home. It's just maybe 3 people or 2 people, or hopefully nobody at all other than the employee who tested positive. But highlighting, again, the importance of those preventative steps. And if you can point out that, look, we have these preventative steps in place, everybody followed them. As a result, very minimal number of people have had to be quarantined. We need to keep following them. They're working, they're helping you, they're protecting you. But just highlighting all of those things again, highlighting, the cleaning efforts that you're taking, highlighting the importance of hand washing, all the stuff you hear on the news. But just reassuring your employees that we are doing all these things to keep the virus out of the workplace. It is safe for you to come back to work. We want you to be monitoring your symptoms. If you're not feeling good, you're not going to come to work. Those are all things you're going to want to tell employees. You're also going to want to, reassure them that, yes, we are operating. And if you're operating right now, in most cases, it's because you are a critical infrastructure operation. So you're going to say, yes, we are operating. Yes, the things we are doing are critical to our nation's infrastructure. We have a responsibility to do them, but top priority for us is your health and safety. So reassuring your employees of all these things is going to make them feel comfortable to come back to work after they might be unsettled by the fact that somebody they certainly are likely to know and may have been around tested positive for COVID. And then you're going to explain again, right, the symptoms. So here are the symptoms you should be looking for. If you have any of these symptoms, we don't want you coming to work. You know, what to do if you become symptomatic, and if you're off work, that is simply stay home and let us know. If you're at work, it's to go talk to your supervisor from a safe distance and tell them you're feeling symptomatic, and they're going to tell you to go home, and that's just it. So letting them know that this is what we expect, this is what we require, so that we can hopefully prevent another positive test in the workplace. And then I do think it's important to reaffirm to people the importance of, you know, the work that they're doing, because some people may begin to question after somebody tests positive, why am I coming to work? They may think this is crazy. You know, they may view it as putting their life at risk, even though, you know, the vast majority of cases are those with mild symptoms. But if you reaffirm what it is you're doing and why it's so important, and that you're proud of your employees, and that the nation needs them, you know, it's a responsibility, all the things that you've probably already communicated to them, it's going to make them more likely to come back as well. They're going to realize that they're doing this, you know, sort of for the greater good. You know, it might be sort of a soft, rah sort of thing, but I do think it's effective. And I think written communication to employees, sort of laying all this out, and I've drafted a few of these, and I'm sure Matt has as well, explaining what's going on and explaining all the ways that employees are being protected after a positive test. A written communication can be really effective, and so if anybody, you know, is looking for help with that, Matt and I are here. Your employment lawyers are able to help as well. But I think that's the type of thing you want to put in writing.
Absolutely, and a big part of that is what we're going to talk about next, which is cleaning, and this kind of fits into all three of those bullet points. We clean, obviously, that because if somebody has tested positive in the workplace, we want to make sure that we provide a sanitary place, and we get rid of any trace of the virus in the workplace. But at the same time, it is just as much about reassuring the employees who are still coming to work on a daily basis that the workplace is safe for them, and that they are not going to catch the virus necessarily just because they're working in a place where somebody else who has since tested positive was also working. So cleaning is a big part of that, and let's get right into some of the best practices for cleaning. So first and foremost, if somebody tests positive for COVID-19, we want to stop operations in the area where that employee worked, plus areas where if the employee interacted quite a bit with other employees who then went to other areas of the office or the plants or whatever the work situation is, we want to stop work in those areas as well. And we're stopping work just temporarily, but it's so that we can do a good, deep, thorough clean. Obviously, if operations are continuing as we are going through and completing this process, we're not going to be able to cover every aspect and get every doorknob and clean every surface. And so we want to make sure that we're doing a thorough part and a thorough job here. Some obvious considerations here. We should cordon off all common areas to make sure that we get those clean and sanitized. And then depending on the size of your operations, depending on the scope of the virus and the number of employees who have been affected by it, depending on how far the employee who has tested positive went and interacted with others in the facility, you may want to consider stopping all operations and cleaning everything. This is obviously a drastic measure in terms of operations because they would have to stop in the process, but this is the best way that we can assure our employees that we have taken every single possible step to make sure that the facility is as clean and sanitized as possible. And so it might not necessarily, or it might not be necessary in each situation, and it might not be possible in some situations, but in other situations, it will be both necessary and possible. And so it's just something that we should consider as we go through it. Neither Patrick nor I are cleaning experts, and I'm sure our wives would attest to that, but the CDC has given some it has given some cleaning recommendations depending on the type of surface that we're dealing with. So hard surfaces, counters, machines, doorknobs, things like that. It's a pretty easy process. So we want to first clean it using detergent or soap and water. Simple. It's readily available even in this day and age of hoarding. And then disinfect it. And most EPA registered household disinfectants should be just fine. So we don't necessarily need anything incredibly powerful or specialized. Normal cleaners or even a diluted bleach solution should work here. For soft surfaces, so rugs, window drapes, and things like that, the items should be cleaned and laundered according to the manufacturer's instructions using the warmest possible water setting. One word of warning here, though, is the CDC recommends to not shake out these items. So again, things like curtains, drapes, towels, if you're moving them from one area to another, don't pick them up, shake them out, and then transfer them because, as you can imagine, when you shake them out, you're just spreading the virus from, if it's in that material, throughout the air, and then anybody who is breathing in that air is going to breathe in the contaminated particles. And so we want to try to limit the movement as much as possible. Perhaps you put the soft item in a container or a bag to transfer it, but certainly try to avoid shaking it out to prevent the virus from spreading. And then electronics, I certainly could do a better job with this, but things like keyboards, our phones, computer mice, just to make sure that employees are wiping them down frequently. And this should be done regardless of whether or not we're living in a COVID-19 world. Of course, if you're anything like me, you don't do it nearly enough, but wiping it down, just a Clorox wipe is fine or anything like that. If the manufacturer for the device, if it's a specialized electronic device, has recommendations on how to clean or sanitize it, follow those directions. And the CDC says if there's no advice available, using some sort of alcohol-based wipe or spray can do the job. So pretty simple and straightforward there. Let me move to this next slide, and then Patrick, maybe we can take some questions here. This is just an overview of what we should be doing if somebody tests positive in the workplace. So we want to limit their exposure. We want to quarantine other employees who may have been exposed or interacted with the individual who has tested positive. We want to communicate with our employees to make sure we're all on the same page because employees certainly appreciate it when we give them information, and then cleaning it. So 4 steps. Looks really simple on that slide. We understand that there's a lot of nuance that goes into it, but if we follow these 4 main steps, we'll be doing the best that we can to stop the spread of the virus and also work with our employees to make sure that they feel comfortable and understand what's going on in the workplace. So before we go on, do we have a couple questions that we can answer here?
Yeah, so I have a couple. One, there's some confusion about the new executive order and how it relates to the older executive order. So as you've heard us say, Miller Johnson, that is many times, the prior executive order, the stay safe, stay home executive order requiring all of us to shelter in place, we said that if your business is impacted by that, employees who aren't working because of that order are not entitled to paid sick leave. That is still true. The new executive order, the one issued on Friday, which is 2020-36, is different because it's not something directed at businesses. It is directed at the employee specifically and is telling those employees, if you have a positive test, if you have a symptom, if you have close contact with someone with a positive test or a symptom, you need to stay at home. So the nature of that order changes things. It becomes now, the way the Department of Labor would look at this is, but for that order, the employee would be able to work. So if you're not operating right now, or an employee isn't working right now because of the shelter-in-place order, the prior executive order, then they're not entitled to paid sick leave. However, if you're operating now, whether it's because it's a minimum basic operation or because you're critical infrastructure and your employee fits one of the categories of that new executive order and can't come to work, then it becomes a but-for test. So but for the employee having that symptom and the new executive order, the employee would be able to work. But because they're not able to work, now they're very likely to qualify for paid sick leave. So that's a important distinction to make, can get a little confusing. If anybody has questions about that further, you can feel free to reach out to Matt or I directly, and we'd be happy to talk through it with you. But that's a question we've gotten somewhat frequently, and so I just wanted to make sure everybody's clear on that one. Let's see, I got a couple more here. So a question is, what if an employee is staying home because they're afraid of getting exposed at work? Are they subject to the executive order not allowing them to be discharged? The answer to that is no, unless they have some sort of doctor's note saying they need to quarantine because they're at high risk or have been exposed or something like that. If they're simply just not able to come into work, are they protected by the executive order? No, they are not. So you can do whatever it is that would be your policy and practice on that, whether that would be paid sick leave or discipline or termination or unpaid sick leave, but you can handle it however you choose. Another question is, if we report to local state health officials, wouldn't that duplicate the hospital that administered the test, telling them and we wouldn't want that person to be counted twice? That's correct. You're not obligated to report that the employee tested positive. You are more reaching out to, say, state health official, local health official. I know you're aware or will become aware that this person tested positive because the hospital is a mandatory reporter to them. What we are contacting you about is how you'd like us to proceed. Here's how we plan to proceed. If you have any suggestions on how we proceed, or you want us to do something different, or you want to work with us to contact trace, please feel free. But you're more reaching out to get them involved in your process as you take the next steps after the positive test, not to report the positive test.
I have a question here, Patrick. The question is, test results can take a bit of time to come back. What should we do in the meantime regarding notifying employees, cleaning, sending people home? I think a lot of that's going to depend on why the employee was tested. So if the employee is showing symptoms himself or herself, we should probably take these steps that we've talked about. We should limit the employee from interacting with other people and make sure we at least identify the other employees who interacted with that employee. And I would follow these cleaning steps too. If the employee is showing symptoms and they've been tested, from as I understand it, tests are still so limited that people who are tested, a lot of times there's a good reason why they are tested. And so whether the employee has COVID-19 or they don't, obviously there's something going on there, and this would be a good opportunity to go ahead and clean the facility the best we can, or at least clean the area where the employee was working, to ensure that we've got everything sanitized and we're not inadvertently spreading anything throughout the workforce. So I don't think it necessarily takes a positive test result to trigger a lot of these things that we've talked about this morning.
So another one here is, I have an employee whose spouse tested positive and now the employee has symptoms but hasn't been tested. Do I need to work with health officials if the employee has been teleworking for 3+ weeks? I think the answer to that is no, because the employee's at home, the employee's experiencing those symptoms at home, so you're not going to be at work attempting to contact trace and figure out who that employee's been exposed to. Certainly that employee's spouse will let them know that the spouse has been exposed, and the healthcare officials, whether it's the hospital or local health officials, will be working with that employee on quarantining themselves. If they're having symptoms that are preventing them from working, you're going to address that. But if they're having mild symptoms or, are asymptomatic and can continue to telework, then they should feel free to do that. Another one, we have an employee who serves the public who tests positive, or if we have an employee who serves the public who tests positive, do we need to notify the public or contact those who they served? This could be in maybe a drive-through setting, something like that. I think the answer to that question is no, assuming you're taking appropriate measures, right? Because if somebody's coming through, say, a drive-through, the employee gives them their food. Hopefully the employee has, appropriate protective gear on, washing their hands, gloves, maybe wearing a mask, things of that nature. Then the contact is really very limited. It's going to be, 30 seconds, a minute. Most of the time, the drive-through window might be closed. So I don't think you have to notify the public or contact everybody who came to the drive-through to let them know. But again, very factual situation. So there may be circumstances where you want to do that, depending. But the key is to remember that close contact is some sort of secretion on the person or a prolonged period of contact. And I don't think, necessarily that's occurring in that situation.
Right. It is 9 o'clock, and I understand a lot of people need to get going. We just have a couple more slides I want to get through, and then maybe we can do a couple more questions for people who stick around. And we've covered most of this already, but when can employees return to work? This is just a quick summary that you can use. So if the employee have tested positive, they can return to work after all of these are met. So no fever for at least 72 hours without the use of a medication that reduces fever. All the other symptoms have improved, so the cough or the shortness of breath goes away. And at least 7 days have passed since the employee's first symptoms appeared. The CDC also says that instead of the 7 days, the employee can receive 2 negative tests in a row, at least 24 hours apart. I'm not sure anybody is receiving 2 tests at this point, at least 24 hours apart. If we ever get to the point, though, where the tests are widely available enough where that is possible, this would be another consideration in place of the 7 days since first symptoms. And then if the employees who did not test positive, but they were near somebody who did, these individuals can return to work after 14 days have passed since their last close contact with the individual who was sick. Again, considering what close contact or prolonged contact is. We're talking about usually within 6 feet for at least 10 minutes. This, of course, assumes that the employee does not have symptoms and has not had additional close contact with somebody else who tested positive or had a COVID-19 symptom. And I'm going to go off that slide so you don't have to stare at our faces there as we answer a couple more questions here.
So one of the questions, and this is an important one, is if an employee is having symptoms and seeking medical diagnosis, in addition to FFCRA leave, would they also have protection under the FMLA? Very, very possibly. And that's something that everybody needs to be aware of, right? So you're going to use your normal FMLA test, assuming you're normally covered by the FMLA. This is different from emergency FMLA, which only applies to childcare situations. This is if somebody has a serious health condition, as it would be defined by the FMLA. You should be aware of that. You should, to the extent that you think it's at least close, give them the certification form, see what their doctor says about their condition and when it will resolve and what treatment's required. And if it qualifies for FMLA protection, then make sure you give them that FMLA protection. So that's something to always keep in the back of your mind, is that, we have all these new laws swirling around, and there's a lot of them, and it's hard to keep them all straight, and they can be distracting. But the old laws still could apply too. And one of those laws that is most particularly applicable in this situation is the FMLA, probably more so than the ADA, because this is hopefully just a short period of time, 2 weeks, 3 weeks, 4 weeks on the top end. So probably not going to qualify as a disability unless something else happens, but very well could qualify as a serious health condition. And so I think it's important for everybody to remember that.
Another question here is, do we have to give all those who were sent home due to exposure to the positive person the 80 hours of paid leave? And the answer is no, and not necessarily because of exposure to the person. If any of the other factors which trigger the emergency paid sick leave come up, so if the person has been advised by a healthcare provider or is experiencing symptoms themselves and is seeking treatment, then yes. The only situation would be is this is, again, one of the scenarios where we would advise you to talk with your legal counsel because depending on what the contact was, depending on what's going on, this may fall under the new executive order, in which case it might qualify for the paid sick leave. But in and of itself, I'd say the answer is no, with the caveat that we should talk about this before we make any decisions.
All right, and with that, it's just a little after 9, so we will end this. You can feel free to reach out to either Matt or I if you have more questions. Our contact information is on the last slide. You can find us on the Miller Johnson website as well. We appreciate you taking the time to attend, and stay tuned tomorrow for more on the new executive order if you still have questions or want a deeper dive into that. So we really appreciate you taking the time to be with us today. Thanks.
Thank you.